Hey, it's Dr. Kelvis with Liberty Family Medicine. I want to go over some common questions that you should ask your doctor. And I know a lot of times people don't even know what to ask, right? You get this diagnosis, you don't even know what it means. You may feel overwhelmed with that. You're thinking, do I have to be on medication? Am I on this medication for the rest of my life? Can I even afford the treatment? Go in with a list of questions because you're always going to forget. And unfortunately, now in healthcare, health business, time is money. And so your physician may want to spend time with you, but working in the ER that's with a patient. And even if I knew that they probably needed 30 minutes, so it's not that your doctor doesn't want to spend time with you. It's that there's a lot of administrative pressures that keep us from spending time with you. So write everything down. I love when my patients come in with a folder and their list. So some common questions to ask: what are my treatment options? Often a doctor will say, you have this disease, we must treat it with this pill or this exercise plan, whatever. Ask, well, what are your options? For example, if you have diabetes, or you're newly diagnosed with type 2 diabetes, or your triglycerides and your cholesterol panel is just a little high, you might, if you're really strict with your exercise and diet plan, like with me, I'm okay to agree that, okay, we'll just do these lifestyle changes and we'll do like 4 grams of fish oil every day and high doses of niacin, and then we'll hold off on the statin or, the fibrate medication. So ask about your treatment options. Um, and then always ask, are these tests safe and accurate? Medication is poison. It is something that we have created in a lab that we have learned with years of training how to manipulate. But still, you should know what what to look for. I have sometimes patients that tell me, "Oh, I don't want to know the side effects because then I'm going to look for them and I create them in my head." I don't like that because medications, you can develop an allergy, life-threatening things, and you need to be aware. You need to know what to look for. Um, Also asking, how accurate are they? So, great example with the COVID PCR nasal swab. I want to say, I think the last study I read, it had a false negative rate of, one like or 33%. That's pretty high. So, if you had a known exposure, you have all the COVID symptoms, and you test negative for COVID, you probably have false negative. Another great example is like prostate screening. So, with prostate screening, we order what's called a PSA. This is a blood test, a prostate specific antigen. It is a very good test to rule out prostate cancer. So, that means that it's sensitive. It's not very good to rule in disease, though, which means it's not very specific. And here I'm getting into a lot of statistics and stuff, but ask your doctor, what's the sensitivity? What's the specificity? What's the success rate? In another video, we talked about back surgery. While that might seem like a very handy way to fix back pain, it may only work 50% of the time. That's a good statistic for you to know. Also, ask, how long will the treatment take? Is this a medication I have to be on for the rest of my life? Can I afford that? Or is it something like, like for toenail fungus, where you only take that medication terbinafide for 12 weeks? Um, let's see, what are the side effects? And then ask, how do I know if the medications are working? So I do this a lot with my patients that have high blood pressure. Most practices, patients see their doctor once a year, once every 6 months, and they only change their blood pressure meds once a year, once every 6 months. I switched to direct primary care, and why I love this job, I have my patients email me their blood pressure log every 2 weeks. And I'm looking at those numbers, at the trend. Do we need to increase? Do we need to decrease? Maybe you don't need to be on these meds anymore. Um, so ask, how do I know if the meds are working? To make sure you're being dosed correctly, or maybe you're on the wrong medication. A lot of times, physicians will start a treatment, and if they see improvement, then that confirms the diagnosis. So communicate with them. Ask, how serious is my illness or condition, and how will it affect the rest of my work and home life? I think a lot of times patients may not understand the severity of coronary artery disease or type 2 diabetes because they are big, nebulous Latin words. And we don't always have enough time to actually break the science down for patients. I try to, but I appreciate in previous jobs I was not able to. Um, I think so often it is missed, in that conversation. If your cholesterol, triglycerides, if you will develop heart failure in 10, 15, 20 years. You will have a heart attack. Or is it just that, well, you might have some leg swelling or your headaches might increase? I don't know. So ask, um, how serious is this? And then ask also what caused this illness. We are what we eat. This video isn't about diet, but I could talk about that for years. Um, the what was his name? The physician that invented EKGs or did the first one. He made a comment that no man should die of a heart attack before 80, and if you do, it's your own fault. And and that might sound kind of harsh, but are you exercising? Are you smoking? How's your diet? Lifestyle changes, that's 50% of the battle. So as a physician, right, I can recommend medications, I can open the door for you for therapy, but you ultimately have to walk through it. um, I had a very cantankerous patient once, just tell me flat out, well, you're a doctor and you should fix my heart. And I said, no sir, it's your heart, you have to fix it. um, he and I are still friends, it's fine. Also ask, what other diseases could be causing my symptoms? Your doctor's allowed to be wrong. You might think your chest pain is just acid reflux. Well, maybe it is your heart. What other things do you need to be paying attention to? Am I really short of breath when I'm having my acid reflux? Then it's probably not acid reflux. Um, Ask, what are my long and short term prognosis? And then ask, what would happen if I did not receive treatment? Asking what sort of things you should be anticipating. So, chronic back pain, if I don't exercise, if I don't lose weight, what should I expect? You can expect to probably be, I don't know, depending on your disease process, you may not be walking very well in 5 years. Um, Always ask about the cost. So, healthcare is entirely unaffordable. If you have health insurance, great, but I appreciate that millions of Americans don't. There are places you can go where it's cash pay. So, for example, here at my clinic, we found a company that will do heart ultrasounds for $300. Normally, that's a $900 procedure. I had a patient the other day with diverticulitis. I really needed to get a CT of her belly at the local hospital. It was like $1,300 to order that. But we found a radiology place a little farther out in Kansas City that would do it for $300 or $400. So there are, places are willing to work with you if you are cash pay. And sometimes it's cheaper to do that than to pay your full deductible and go through health insurance, depending on your plan. If you have like anyway, this isn't about health insurance, but, and then last question, are there alternatives to this treatment, medication, or procedure? And that kind of goes into, um, what are my treatment options? But don't be ashamed. Like if you don't understand, take notes. Stop the physician or whoever you're with if you don't understand. If they start rattling off all these big medication names, or ask them to like explain the anatomy. So I always bring my laptop in the room and I will pull up a skeleton, or I'll pull up a picture of all the muscles and things, and I will make sure they understand. I actually make my patients repeat things back to me in their own words. That's how I know if they understand or not. So, and when you're buying a house, you ask your realtor all the questions. You ask your financial advisor everything before they organize your portfolio. You should ask the same when you're talking with your physician.